Welcome back. You're listening to The Voice of Russia with me, Scott Craig. The UK is often referred to as having the highest rate of drug addiction in Europe. In Russia, the situation is also thought to be much worse, though reliable statistics are often difficult to come by. Drug treatment programs in both countries are trying to cope with large numbers of patients, often with complex problems, who are struggling with addiction. But treatment methods and outcomes vary. And while needle exchange programs are widely used in the West to help prevent HIV transmission amongst drug users, they do remain rare in Russia. Does that need to change to help combat drug use and HIV rates there? To discuss this, I'm joined here in London by Alex Fleming. He's Policy Information Manager at the National Treatment Agency for Substance Misuse, part of the NHS here in the UK. By Brendan Hanlon, he's CEO of AVERT, the international HIV and AIDS charity. And on the line from Moscow by Darya Khalturina, she's co-head of the Anti-Tobacco, Alcohol and Drugs Coalition there. Darya Khalturina, let me come to you first. Can you just give us a sense of what the overall situation is in Russia right now with drug use and drug treatment?
Oh, the situation is rather hard because Russia has, I think, the highest prevalence in the world of injective opiates use, which is perhaps the heaviest of all drug abuse problems. And according to the United Nations estimations, about 1.5 million people are using heroin. And there are, of course, other drugs there, but they're not as deadly, mostly. As for HIV, the prevalence is growing, and we have for at least about 500,000 people officially living with HIV. There is also the problem of viral hepatitis, people living with this too. As for treatment, unfortunately, we rely on traditional narcology, and the usual practices of opiate addiction treatment, such as replacement therapy, are not used in Russia. There is a strong negative opinion among Russian authorities, both anti-drug agency and Ministry of Health, against replacement therapy. The official position is perhaps that replacement therapy does not decrease the number of overdoses. Unfortunately, we do not have real figures with the successes of treatment traditional in narcology centers. Generally, we have narcology school for treating substance abuse, and there is quite a large number of centers. But typically, this is kind of medicalized treatment.
Darya, we'll talk about a lot of the points that you raised there in a bit more detail. But let me just ask you, what is the trend in drug use and treatment in Russia? Is the situation, in your view, getting better, or is it getting worse?
I think it's stagnating is extremely bad. I mean, in drug use, and it's also stagnating as in drug treatment. And as for the people living with HIV, the epidemic is growing.
Alex Fleming, let me come to you. Can you just give us a brief snapshot of what the situation is here in the UK in terms of drug use and drug treatment?
The situation is that in the general population, drug use is a declining trend. The government estimates that about 10 million people have ever taken a drug in their lifetime. Very, very few of them become dependent users. And the population of people that treatment services in the UK and in England in particular treat is largely made up of heroin and or crack addicts. And the latest estimates is just over 300,000 of those people exist in the UK, and just over 200,000 of them are currently in treatment and benefiting from that.
In terms of the trend, I mean, is it upwards or downwards?
With both general drug use in society and problematic drug use, that latter group we talked about, it's a declining trend.
Nevertheless, as I said in my introduction, the UK is often referred to as having one of, if not the worst, drug addiction problem in Western Europe. Is that accurate?
I certainly think it's accurate to say that as a proportion of the general population, a large amount of people have drug problems. But as I said, that's a declining trend, and treatment services are available for all.
We'll talk more about the specifics of treatment in a moment. Brendan Hanlon, if I can come to you. In terms of HIV diagnoses, the latest statistics indicate that about 5% of infections in the UK are caused by drug use. How confident are you that that figure is accurate, and what sort of change is that, do you think?
It sounds accurate in the sense that HIV is always being transmitted through shared needles and the like. In terms of the trends, the rates of HIV is growing in the UK, and this year, 2011, there'll still be over 100,000 people who have HIV. In terms of the way that it's perceived, I think that over the last few years there have been quite a lot of advances in terms of HIV, in terms of people being able to live with HIV, but it seems to be rather under the radar in the sense that because people have ARVs and access to ARVs in the UK, that it seems as though because it's a disease that now that you can live with, it seems that people are becoming a bit more lax in the way that in their behaviour, and so therefore we see an increase in HIV.
In terms of the situation in Russia, I know your organisation has done research on HIV prevalence in Russia and HIV prevalence as a transmission as a result of IV drug use. What have you found there? Well,
first of all, statistics are quite difficult to determine, and so when we were looking at the situation in Russia, we found three different sources. It appears as though there are between 1.5 to 2 million, 1.5 million to 2 million people who are injecting drug users in Russia. Incredibly, 37% of those people have got HIV. The only region in the world where HIV is really on the increase is in Eastern Europe, Russia, those kind of areas. So, for example, 2.3% of injecting drug users in the UK have HIV compared to 37%. So there's still an awful lot of work that needs to be done around injecting drug users in Russia and the surrounding areas.
Darya Khalturina, one thing I wanted to ask you about specifically is needle exchange. It's not very widely used in Russia. However, there's a lot of evidence from elsewhere in the world that needle exchange seems to help. Why do you think needle exchange isn't being used or made more available in Russia?
Well, there were programs of needle exchange initiated by various non-governmental organizations which were cooperating with the global anti-HIV movement. But unfortunately, the Ministry of Health found the results of those unsuccessful. It pointed out that the prevalence of drug use increased in those numbers where needle exchange programs took place. I'm not sure how to estimate those figures. Maybe they were just the regions with the heaviest epidemic problems. But still, this is the official position by the Minister of Health. At the same time, I think what I heard from health activists in Russia that needle exchange programs can be mostly effective as a way of outreach and in combination with other programs, because I understand how they might help in reducing the HIV prevalence, but I don't understand how they might help in reducing dependence rates. So basically, they are viewed as this idea is viewed by official government agencies as suspicious. I think the problem is that the NGOs did not provide enough of sufficient evidences that they work, and in general, the research which is available in Russian did not sound that convincing to me out there in Russian.
Brendan Hanlon.
What I do is I draw attention to studies which have been undertaken concerning needle exchange programs globally, if you like. There's a report published within The Lancet which said that cities which do have exchange programs across a 5-year period, HIV infection in those cities decreased by 5.8% over those 5 years. And simultaneously, studies which didn't have programs, HIV infection actually increased by 5.9%. Now, that was followed up by a report from the World Health Organization, which showed that needle exchange programs do reduce HIV. And further, there's no evidence to suggest that the presence of a needle exchange program increases drug use. And so across the world, I think that on a global scale, I think that what's being shown is that in terms of needle exchange programs do help to reduce the prevalence of HIV. And particularly, I think the World Health Organization suggested that there'd be a 9-point plan. On its own, it doesn't work. It needs to have a lot around it, and that's expensive. But in Russia, for example, Russia does have the money in order to put into practice these programs, but Russia's focus is on there's nothing, for example, for drug substitution. Its focus is on ARVs to provide the medication for people who have HIV. But often it doesn't reach the people where it's needed. And quite a lot of the money is also spent on anti-drug advertising and counselling and the like. And the overall message from Russia is that the focus is not on needle exchanges, which have been proven to be worked, but it's on cessation of drugs use.
Alex Fleming, let me bring you in there. On the question specifically of needle exchange, is that money well spent, or is the Russian government right to have a more sceptical line on it?
The position in the UK has been fairly consistent since the Thatcher government of the mid-1980s. What happened at that stage was that a growing awareness and scare, a fear of an HIV epidemic led the government to accept needle exchange as well as opiate substitution therapy as key components of a sort of government public health approach. They made the decision that the spread of HIV, if you like, was a bigger threat than drug use itself. And since that time, successive governments have put significant investment into funding what we call a balanced treatment system. So lots of different approaches, needle exchange at one end to give people sterile needles and syringes, which we know helps reduce HIV, and injecting drug users and kind of control the spread of these bloodborne viruses.
But is there a concern that actually needle exchange in some way legitimizes drug use?
I think you hear people voice that opinion. I think the government's taken a more pragmatic view to say that this is a sensible use of public money. It's led to England and the UK having one of the lowest rates of HIV and hepatitis C amongst injecting drug users in the Western world. So I think Brendan was right to talk about, some of the slightly concerning rises in HIV in the UK in general. But amongst the injecting drug using population, we haven't really seen that, and it's been capped at very low levels compared to similar Western European countries.
I want to talk to you more about access to treatment in a moment, but one of the main treatment methods that's used is substitution therapy, things like methadone. Darya Khalturina, in Russia, as I understand it, substitution therapy is actually illegal, yet there is evidence that it does help to reduce crime, it does help to reduce dependency on illicit drugs. In your view, is this something that should be being used in Russia?
Well, I believe that Russian people are not aliens from some other planets, and what works in other countries must work in Russia too. What I find troubling is, again, is lack of well-designed advocacy papers on that, despite of the fact that very many NGOs have been working on this. And if we return to questions, I think my opinion is yes, if it helps to reduce the HIV rate, the crime rate, it should be used. And my question to other experts is, do you think it really helps to reduce the drug use over the time?
Alex, what is the evidence on substitution therapy? What is the evidence on methadone and things like that? Is there evidence that it actually helps?
Yeah, absolutely. I mean, in the UK, we have a body called NICE. They are essentially an organisation within the NHS that looks at the evidence of any medical treatment's effectiveness and whether it delivers value for money as well. And NICE were very clear, as well as the World Health Organization.
The overall situation is in Russia right now with drug use and drug treatment?
Oh, the situation is rather hard because Russia has, I think, the highest prevalence in the world of injective opiates use, which is perhaps the heaviest of all drug abuse problems.
Agency for Substance Misuse, part of the NHS here in the UK. By Brendan Hanlon, he's CEO of AVERT, the international HIV and AIDS charity. And on the line from Moscow by Darya Khalturina, she's co-head of the Anti-Tobacco, Alcohol and Drugs Coalition there. Darya Khalturina, let me come to you first. Can you just give us a sense of what... But treatment methods and outcomes vary. And while needle exchange programs are widely used in the West to help prevent HIV transmission amongst drug users, they do remain rare in Russia. Does that need to change to help combat drug use and HIV rates there? To discuss this, I'm joined here in London by Alex Fleming. He's Policy Information Manager at the National Treatment
And according to the United Nations estimations, about 1.5 million people are using heroin. And there are, of course, other drugs there, but they're not as deadly, mostly. As for HIV, the prevalence is growing.
Welcome back. You're listening to The Voice of Russia with me, Scott Craig. The UK is often referred to as having the highest rate of drug addiction in Europe. In Russia, the situation is also thought to be much worse, though reliable statistics are often difficult to come by. Drug treatment programs in both countries are trying to cope with large numbers of patients, often with complex problems, who are struggling with addiction.